How's it going, everybody? All right, so for those of you who are joining us right now, welcome to another Benefits in Action webinar. This one is on benefits updates and changes, as well as the basics of benefits in general. Give a few minutes for people to hop on, and then I'll go through a couple of housekeeping items.
We have 99 registered. Let's see. And if folks don't join, they'll get a recording of this webinar, as well as we'll have it available on our YouTube channel, along with our other webinars. So if you weren't with us last week for the financial fitness webinar, that's available on our YouTube channel, as well as a recent Social Security 101. We're going to post another Medicare 101 that was recent pretty soon, so stay tuned for those things too.
And if any of you have a last friend or so, get us to 100. Send this link out. Oh, nice. Yeah.
Very cool.
All right, I'll give it another minute, then we'll get started.
Corey, thanks for joining us today as a co-host. Corey is what is your title, Corey? Lead intake manager?
Coordinator?
Coordinator. Lead intake coordinator. You make sure that all the things happen as they're supposed to on the front end.
Yeah, definitely. Kudos to Corey.
Sorry, I was trying to figure out how to unmute myself.
No worries, you're good.
Are we ready again?
Just waiting for the minute to change to 10:03. Yep, all right. So we are ready. We are live. Thank you, everyone, for joining our benefits update and changes webinar. As Rachel was saying, this is a part of a series of webinars that we're hoping to give now and in the future. We really appreciate your participation. First and foremost, just have a couple housekeeping items. Number one, this presentation is being given in English, but if you'd like to translate it into Spanish, we have that capability. You can use the caption feature in your Zoom to translate it into Spanish or any number of languages that Zoom offers translation for.
Hola, buenos días. Si desea escuchar en español o otro idioma, utilice la función de subtítulos en la parte inferior de Zoom.
And we'll give a couple seconds for people to utilize that caption button if they need translation. If anyone has any questions, feel free to speak up or put it in the chat. We'll try to guide you to that.
Sure.
All right. I hope everyone has had the chance to utilize the caption feature if needed. If you have any questions, feel free to put them in the chat. We can guide you through that technically. Otherwise, just a couple other housekeeping items. This webinar is meant to be a high-level overview of benefits, as well as some of the changes that are coming to certain benefits as a result of the 2025 Budget Reconciliation Act. It's not going to have every single detail or even every single change that's coming, just the ones that are most relevant for clients particularly. And then also, while I always love an informal presentation, since we're going to have about 101 people today, if people could just put their questions in the chat or alternatively, wait until the question and answer section that we're reserving for folks so that we can answer everyone's questions. And then excuse me, with that, I'll begin.
Do you see one question
Yes.
about audio not being activated? That's correct. So since this is a webinar, you don't currently have the option to turn on your audio unless you're one of our panelists. So I don't think most of you are. And if you do have a question and we would like for you to be able to speak and you'd like to, we can certainly turn that feature on for you on a case-by-case basis. Thanks, folks. Take it over, Eric.
No worries, Rachel. Sounds great. So this is our agenda for today. First, I'm going to introduce you to myself, and then Rachel and Anna are going to introduce themselves. We'll talk a little bit about benefits in action. We'll also talk about our programs, and intertwined with our programs, we're going to talk about changes to the benefit programs that are going to experience changes now or in the near future. And then after that, we'll have plenty of time for question and answers. So first of all, my name's Eric Gonzalez. I am a program manager at Benefits in Action. What I do here is I manage our Social Security and benefits planning programs. So Social Security consists of, applying for disability, applying for retirement, things of that nature. And benefits planning is analyzing how work can impact benefits for folks if they're planning on going or returning to the workforce. Kick it off, Rachel.
Rachel Wise, I'm the manager of marketing and communication here at Benefits in Action. I also manage most of our outreach, so you may see me in the community. Excuse me. And I also work with a lot of our community partners to establish that collaboration and share those resources and referrals. So if you have an event coming up or would like to establish a partnership with Benefits in Action, I'm usually your point of contact for that. So feel free to reach out. Thanks.
Hello, everyone. My name is Anna Marchman Santeles. I am the program manager for Connect for Health, and I am also the manager for our Colorado Springs office.
Awesome. So this is a photo of our team, and this is our mission statement. So Benefits in Action is a nonprofit organization dedicated to connecting our diverse community with the support and resources they need to thrive. Now, notice how I used the word thrive. So that's different than living, that's different than surviving. At Benefits in Action, we want people to live their best life possible. That's why we use that word in our mission statement. So just generally, what are benefits? Well, benefits are what are needed so that we keep the most vulnerable off the streets, receiving enough food, shelter, money, and healthcare to at least survive. And why benefits in action? Well, we're a one-stop shop for applying for, using, and managing most benefits. And we'll get into those benefits in just a second, but if you can think about a benefit other than housing, we handle it. And we're trying to be the content matter experts when it comes to these benefits. That's one of the reasons for these webinars, just trying to educate our community. So these are the programs that we currently offer. As you can see, it's pretty extensive. So now I'm going to go through the programs. I'm going to start with SNAP and then go down to Magi, Medicaid, and then some of the other forms of Medicaid, and so on. And for each of these programs, we're going to talk about how they were recently and how they are now, just so we can compare and contrast those changes. So for SNAP, SNAP stands for the Supplemental Nutrition Assistance Program, formerly known as food stamps, and it provides money that can be used to purchase certain food items. So basically, the rule of thumb is you can't buy pre-made food, but you can buy the ingredients needed to make food. So for example, you can't go to the store and buy a pre-made rotisserie chicken, but you can buy chicken, you can buy spices, you can buy the ingredients needed to cook a rotisserie chicken. And then, of course, SNAP has an income-based limitation dependent on your household size. Oh, sorry, duplicate slide. So here are the changes to SNAP. So SNAP has a lot of changes going on with the 2025 Budget Reconciliation Act. So most notably is that there is going to be a new work requirement for most individuals under the age of 65. Previously, the age limit for work requirements for SNAP was 55. So that's an increase of 10 years. What that means is that unless you're working, volunteering 20 hours a week, or going to school, if you're able-bodied without dependents, meaning you're not disabled and you don't have people that you're taking care of under 14, you have to work those hours. Otherwise, you can only get SNAP benefits for 3 months in a 36-month period. And some of the exemptions that were formerly existed are no longer the case. So there used to be an exemption if you were chronically homeless, you would not have to get a job to keep your SNAP. That is no longer the case. Same things with veterans and those aging out of foster care. There's also some changes to how utility expenses for purposes of are calculated for purposes of SNAP benefits. It's a bit of a complicated calculation, so I'm not going to go into it. Long story short is that people who are getting utility assistance are going to probably be affected and have a lower SNAP benefit. And then there are a lot of changes to immigration status in terms of SNAP. So SNAP benefits have been restricted with the new Reconciliation Act to citizens, green card holders, certain Cuban or Haitian immigrants, and those who entered the U.S. under a compact of free association. And if you are anything like me, you probably read that and said, what in the world is a compact of free association? I'll tell you, I had to research it, but I will tell you. It's for folks from certain countries, such as Micronesia and Palau, who enter the United States without visa restrictions in exchange for the United States being able to essentially establish military bases and have military facilities in those countries. So it's a pretty limited subset. So what that means in real terms for our clients is that most refugees and asylees will no longer be eligible for SNAP. In fact, based off the timeline, they are not eligible for SNAP anymore. And that's not just to make sure that's not a dichotomy between lawfully or unlawfully. Regardless of being lawfully present here, they are not allowed to get SNAP. So this work requirement, it's supposed to take effect November 1st, but I did look at the USDA website as recently as this morning, and they're still issuing guidance on what those work requirements are going to look like and what the regulations are going to be to implement the specifics of the work requirements. Just know that it's time is of the essence. You may hear from clients in the future saying, "Hey, I need to work," or "Hey, how can I prove that I'm disabled?" or "Do I fall into one of the exceptions to these work requirements?" As for the utility expenses and the immigration eligibility changes, those both took effect on July 4th with the passage of the bill.
Do you want to take questions?
Yeah, I can take some questions. Yeah,
So Mike asks, who defines if a person is disabled under this new rule?
that is a really good question. My understanding is that at a minimum, it would be Social Security, potentially also the state of Colorado through things like the long-term care, home and community-based services, and the Medicaid buy-in program. But I'll be honest, I don't know the exact answer. I'd have to get back to you for the 100% sure answer.
But stay tuned
Hmm.
as information becomes available and benefits in action. We do try to stay very updated with this, so as more information becomes available, we'll certainly make sure you guys know. I'm hard to hear. I'm sorry. I'll lean in, guys. I'm speaking into a microphone in the middle of the room. So yes, please stay tuned as more information does come down the pipe about some of these programs or who can define disability under this new rule. Eric, there was also a question about youth aging out of foster care.
Yes.
And what was the summary of that?
Basically, there used to be an exception to the work requirements for certain youth aged 18 to 24 who were previously in foster care. they would not have to work in order to receive SNAP. That is no longer the case. So basically, the exception that was for that small subset of individuals no longer exists.
And so people who are long-term care Medicaid or SSI or SSDI recipients are likely qualified as disabled under this new rule.
Right, likely, yes. Well, SSI, SSDI, like 99.9% for sure. It would be really weird that they wouldn't do that. As for the state of Colorado, just because their standards are slightly different, we'll get back to you with a better answer.
Okay. All right. Good to go.
Now we're going to talk about a little bit about Magi Medicaid. Really important to know, it is a type of Medicaid. So there are multiple forms of Medicaid. This one is called Modified Adjusted Gross Income Medicaid. We just want to clarify that for people because a lot of people think that Medicaid is a lump sum program, when in fact it's many different programs that have different eligibility requirements and are impacting different people. So Magi Medicaid is what most people 0 through 64 have. So it's a health insurance for low income individuals in that age range. It covers doctors and hospital visits, prescriptions, and dental assistance. And its eligibility is income based dependent on household size. However, in states that have approved Medicaid expansion, such as Colorado, there is no asset or resource requirement. So it's just a straight up or down. Are you above the income limit based off your household size, or are you below the income limit based off your household size? Now, some changes are that, like SNAP, there are going to be work requirements. Similar to SNAP, same things. It's a bigger effect on people than it is for SNAP because SNAP did previously have some work requirements, but Medicaid did not. So now folks 18 to 65 are going to have to show that they're working unless they have a disability or they're taking care of a child under 14. Notice that that 14 age, it's not 18. It used to be 18, but it's actually 14 now. Now, Medicaid redeterminations, or another word for redetermination is when you have to renew your Medicaid. Those periods have been shortened to every 6 months. In the past, it was once a year. So now people are going to be recertifying their Medicaid twice as much. The same immigration restrictions that came into effect for SNAP are also in effect for Medicaid. And then, really important to know, there's going to be reduced retroactivity. So what does that mean? Well, in the past, Medicaid allowed you to retroactively get Medicaid up to 90 days or 3 months before the date of your application. What that would do is if you had a hospital bill and then you had to apply for Medicaid, it could potentially cover that hospital or doctor visit if it was within that 90-day period. Now, or in the future actually, it's going to be reduced to a 1 month retroactivity period, meaning that it'll only go back 1 month rather than 3 months. And then all of these effects changes other than the immigration changes, which have already taken effect, will go into effect on January 1st of 2027. Now, other types of Medicaid, because at Benefits in Action, we don't just do SNAP, we don't just do Medicaid, Magi, we do just about everything. So these are some of the other types of Medicaid that are available for folks who do not qualify for Magi Medicaid. There's the Medicare Savings Program, the Long-Term Care Program, the Home and Community-Based Services Program, and the Medicaid Buy-in Program. And we'll go through each of them in order. So what are Medicare Savings Programs? So the name Medicare Savings Program is honestly really a misnomer. What it is it's a form of Medicaid that allows folks to pay for their Medicare Part B premiums, and in some cases, deductibles and copays that would otherwise be payable to Medicare. It's an income-based limitation, but unlike Magi and SNAP, it's dependent on your marital status, not your household size. And there is a limit on the assets and resources you can have in order to qualify for this form of Medicaid. There's three different types of Medicare savings programs, and they're tiered. So basically, there's an overall limit where if you're above that overall limit, you don't get Medicare savings programs at all. Within that limit, there are three different tiers. The lowest tier is the QMB program, which pays for your Medicare Part B premiums, as well as copays and deductibles. And then there's two higher tiers of Medicare savings programs, the SLMB program and the QI1 program, which both only pay for the Medicare Part B premium. There's the long-term care and home and community-based services programs. So that's what you think of when folks have functional limitations that affect their activities of daily living. So it's either folks who need care in an assisted living facility or care in their house. It's primarily for individuals over 65 or those with a disability. The standard is that you need to be at a nursing home level of care to receive these benefits. What that just means is that you need a functional limitation in a minimum of three of the six defined activities of daily living. And then there's a pretty strict asset and resource limit with very few exceptions. What I like to think about with this program, though, is think of them as two sides of a coin. So take a quarter or a penny. The heads is the long-term care program, and the tails is the home and community-based services. They're both a coin in which they both require that you have the same functional and financial limitations. The difference is that the long-term care program will actually place you in a facility for your care, whereas the home and community-based services program allows you to stay in your home and have a paid caregiver come periodically to help you with your needs. Then there's the Medicaid buy-in program, also known as the Working Adults with Disability program. And it is, like it says, for working adults who have a disability. So note that work and disability are not mutually exclusive, neither at the state level or the federal level. So you can work and still be disabled, or be disabled and not work. It depends. And it's also for certain children with disabilities, even if the program is called Working Adults with Disabilities. What it does is it allows you to pay a premium to get Medicaid, regular Magi Medicaid, when you would otherwise have too much income for the program. And work's interpreted broadly. You don't have to be a W-2 employee or a 1099 employee documented in order to meet the work requirements. You can do something as simple as babysitting a grandkid or walking a dog for an hour a month. As long as you have proof of that, you can possibly qualify for this program.
And that there's some exchange of money.
Yes, exactly. There has to be consideration. So it's not free. You have to actually receive the money from the person and report it to Medicaid as income. Documented volunteer for the Working Adults with Disabilities program? I don't know. I will get back to that. So now let's talk about Medicare. So Medicare is very different from Medicaid. If we think of Medicaid for most people as Magi Medicaid, meaning individuals who are through 64, Medicare is the flip side. It's the primary form of health insurance for folks 65 and above, as well as those who have disabilities who have been on the Social Security Disability Insurance Program for at least 24 months, or those who have two specific terminal illnesses, and those are ALS and end-stage renal disease. Those folks, once they get approved for disability, are automatically shifted into Medicare without the 24-month waiting period. So unlike Medicaid, Medicare is an entitlement program. It's not a needs-based program, so there's no income or resource requirement. For most people, you'll get it for free for Part A. We'll talk about the parts in the next slide, but you do have to pay a premium for your Part B premiums and copays and deductibles as well, unless you're eligible for a Medicare savings plan. Now, next year, the premium is going to be $202.90 for most people other than folks who are very high income earners. This year it was $185, so it's an increase of about $17. But yeah, Medicare is complicated. That's why we have dedicated SHIP specialists at Benefits in Action. For those who don't know, SHIP stands for State Health Insurance Assistance Program. The A is silent. Those folks take extensive trainings to help individuals with all of their Medicare related needs. So I like to refer to Medicare as alphabet soup. Couldn't find a picture of the alphabet in the stock images on Microsoft, but this is the closest I got. So we'll go through each of the parts. So part A is what most people get for free if they've worked and paid taxes into Social Security. That covers your hospital visits. So if you're on Medicare and you need to go to the ER or have an inpatient stay at a hospital, that's generally covered under Part A. Part B, as in boy, is your routine doctor's visits. So going to your primary, going to see a specialist, things that do not involve hospitals. And I'm going to skip C for now and go to Part D. Part D covers your prescription drugs. So it's a prescription drug assistance plan. Now I'm going to go to C. The reason why I skipped it is because Medicare Advantage plans are mutually exclusive from Part A, B, and D. So what that means is you can have A and B, which is referred to as original Medicare, with D as an optional add-on, or you can lump them all together in a Medicare Advantage plan. That's Part C. And those are a little different. They may have premiums, they may not, but they're obviously restricted based off of the zip code that you live in and the providers in that zip code. So without going into further detail, before you decide between original Medicare and a Medicare Advantage plan, you would want to talk to a specialist about your options. So the main change to Medicare is going to be the reduced eligibility for lawfully present immigrants. So just like with MAGI and just like with SNAP and the other forms of Medicaid, refugees and asylees are no longer eligible. Some of them were receiving Medicare, so the timeline, in case you have anyone that you're working with who's a refugee or an asylee, is that they will be taken off of Medicare within the next 18 months from July 4th of 2025. So now we're going to talk to Connect for Health Colorado and two things. One, if there's any questions in the chat, love to answer some first. And then also for this section, I'm going to pass over the mic to our Connect for Health manager, Anna, who's going to do a much better job at the details of Connect for Health. Any questions in the chat?
Mhm. Oh, hang on. I'm lost here.
No worries, you're good.
Someone asked if we share the slides. Yes, we will.
We will.
Um, Will folks be able to come back on with Medicare?
I'm not sure I quite understand the context.
Refugees.
Refugees.
Will refugees be able to rejoin Medicare?
No, my understanding is no. They are just cut off unless Congress were to pass a law rescinding the prior law. Yeah.
Are there other options?
There are some. So for most individuals, I mean, there's always private insurance. There's also, just to know, it's not in the slideshow, but there are cost-saving plans that hospitals are supposed to tell you about. So for folks who are under a certain amount of income, I don't know it off the top of my head, hospitals are required to tell you about their cost-saving options to get discounts on care.
Um, is working adults with disabilities slash buy-in premiums expected to go up?
Like the actual premium or people trying to get on it?
I think the premium.
I don't know if the premium is going up. I think it's just set year by year, but it's whatever it is, it's pretty minimal compared to the other costs of health insurance.
Last question I see here in the chat for now. So for all the effects that took place as of July 4th, People are being removed from all programs within 18 months, or is that just for Medicare?
Oh, good
For
question.
the other programs?
That's just for Medicare.
For the other programs, it was immediate.
I believe so. Yes.
All right. I don't see any other open questions right now. So we'll move on to Connect for Health Colorado. And we have our program manager, Anna Marchman Santaliz. Take it away, Anna.
Hello, thank you. Okay, so Connect for Health Colorado, there are quite a few changes happening, and I please let us know if you have any questions. But for Connect for Health is the private insurance plans that are offered through the Affordable Care Act. Um, Connect for Health Colorado, also known as the Marketplace, it was created to allow for everyone to have access to health insurance, and it just creates a framework for structured health plan purchasing options. Typically, Connect for Health is for people that are under 65 who make over the Magi Medicaid income limit. Um, and because of that, Connect for Health does require payments of premiums. It does have deductibles and copays. But when you complete an application based on your household size, based on who needs insurance and your income, there are going to be multiple plans available. I've seen clients apply, and there's about 60 plans available. So there's definitely a lot of options for clients that are shopping around for insurance. So some of the changes that are happening is that before you would be automatically renewed, you would only have to report like you were automatically enrolled into the same program that you were already enrolled in. But starting 2026, that is going away. So now you do have to complete a renewal every year. And if you don't have any updates, that's considered a renewal. If you do have one update, whether it's your phone number changing, your income, just any change, you will have to complete a brand new application. And you're going to have to do that every year. Right now, to get a premium tax credit, which is financial help for your monthly premium, you do have to file federal taxes for the following year, and that's how they calculate your tax credit or financial help per month. So it is very important to get a very close estimate of what your yearly income will be, because if that is very different than what was reported, you may have to pay those tax credit back. So if there is a change in income, please make sure to report that throughout the year so that there are no concerns when you file taxes the following year. Just like the other programs, there have been reduced eligibility for lawfully present immigrants. And then next year, the open enrollment, which is typically November 1st to January 15th, is going to be reduced by a month. So now it'll only be available November 1st to December 15th. So it's going to shorten one entire month for open enrollment. If you do need to apply for Connect for Health Marketplace outside of November 1st through in next year, December 15th, you will need to have a special enrollment period, which is a major life change, such as getting married, divorced, having a baby, losing insurance, moving to Colorado, things like that. Um, 60 days to report those changes. So if it's outside of the open enrollment period, November 1st until December 15th for next year, you'll have 60 days to report that change to be eligible for Connect for Health Colorado. And those changes are starting in effect next year, so January 1st.
Awesome job, Anna. Thank you for that detailed explanation.
Yeah.
Yeah, so now I'm going to go through some of the other benefit
Mm.
programs that have not experienced any changes. through the 2025 Budget Reconciliation Act, but that we help with at Benefits in Action, just so that you all have an overview of those programs and what to expect. So one of the many different programs that Benefits in Action works with is our county cash assistance programs. So what we're thinking about are programs that provide cash or resources other than food and health care. So some of those are the Temporary Assistance for Needy Families program, known as TANF, the Old Age Pension Program, OAP, Aid to the Needy and Disabled, the Low Income Energy Assistance Program, the Colorado Child Care Assistance Program, and yes, there are three C's, and the RTD Live program. So cash assistance, we've broken it down just for simplification purposes in the programs that provide cash and then the programs that provide resources. So TANF, that provides unrestricted cash that you could use for any purpose if you're a low-income individual taking care of children under the age of 18. And there are other issues. It doesn't have to be biological parents. It could be grandparents, aunts, uncles. Unborn children count. So if you're pregnant, you can also apply for TANF. The old age pension is for low-income individuals aged 60 or over. Doesn't have a work history requirement. You could have not worked a day in your life. And if you are 60 or over and you have low income and low assets, you can potentially qualify for old age pension. And then there's the Aid to the Needy and Disabled program, which is for low-income individuals with a disability lasting at least 6 months who have applied for the Supplemental Security Income program. So basically think of Aid to the Needy and Disabled as like a front loading of potential SSI benefits. So it's a loan on the assumption that you may get approved for SSI. Once your case is approved or denied, you then have to pay back that A and D money. And then these are cash assistance programs that provide resources. So the Low Income Energy Assistance Program, known as LEAP, is a seasonal program. It's in effect now. It runs from November 1st through April 30th to provide low-income individuals with help with their heating costs. Now, that's not electricity, that's not gas or water, it's specifically heating. But that being said, even if you get heat paid out of your rent, you can still potentially qualify for the program. Colorado Child Care Assistance Program is for low-income individuals who need assistance with daycare for children under 13. And the RTD Live program is in the Denver metro area. It's for low-income individuals who need discounted bus fare and do not qualify for any of the other eligibility discounts, such as being a minor or being disabled or being over 65. So it's generally for folks 18 to 64 who are low income. Really quick note on the Colorado Child Care Assistance Program. It's actually on a pause in most Colorado counties, so it may not be available where you are. There's a few rural counties, I don't remember them off the top of my head, that are still accepting applications, but most of Colorado is on a freeze. Just wanted to let you know that. So we do justice involved navigation. It's not a specific application, but it is helping folks who've been involved with the criminal justice system with our applications that we normally help with. Basically, what we're trying to do is reduce recidivism. For those of you who don't know, recidivism is the rate at which people who are involved in the criminal justice system may or may not reoffend and go back into the criminal justice system. And it's proven that if you have stability, whether that's health benefits or other benefits, your recidivism rate is likely to go down. So the whole point is to reintegrate people and reduce people going back to jail. Now, we also do Social Security applications, Social Security navigations. Those are programs that are operated at the federal level by the Social Security Administration. And similar to those county cash assistance, if you qualify, you get unrestricted cash, meaning money you could use for any purpose. So what are some of the disability programs? Now keep in mind, this is not an exhaustive list of every program that Social Security offers. These are the three main programs that we deal with at Benefits in Action. So there's Supplemental Security Income, which is a needs-based program that technically isn't Social Security, but it is operated by the Social Security Administration. It's for those with a disability lasting at least a year and low income and assets. The only exception to that is that if you're 65 or over, you do not need to prove that you're disabled. You're automatically considered disabled for purposes of the program. You just need to prove your financial eligibility. There's Social Security Disability Insurance, which is an entitlement program with those for a disability, same definition, lasting at least a year, meeting whatever Social Security's definition is of your condition, and recent work history. So for most individuals, you have to have worked and paid taxes into Social Security for 5 out of the last 10 years, even if that was only part-time work to qualify. Now, conceptually, Social Security disability insurance is taking your Social Security retirement early. So basically, it's younger individuals who are pre-retirement age who are unable to work due to a condition. Once you reach retirement age, it'll transition to retirement, normally with no change in the monetary amount. In other words, retirement and disability are mutually exclusive. There's no such thing as getting Social Security retirement plus Social Security disability. It's one or the other. And then, of course, Social Security retirement is for older adults who've worked and paid taxes to Social Security. Unlike disability, those work credits never expire. As long as you've worked 10 years in your life working and paying taxes into Social Security, you should qualify for some form of retirement benefit. And finally, the last program that we provide at Benefits in Action currently is our food delivery program. What it is monthly food delivery income, food deliveries to low-income homebound individuals over the age of 60. Now, the food boxes include a wide variety of items, produce, non-perishable, we have meats, we have dairy. It's honestly a pretty good box. And then we serve folks for the food delivery program in the 4-county metro area of Adams, Arapahoe, Denver, and oh yes.
Program is currently on a pause, and we expect more information to be available around December 8th.
Good point, Rachel. Thank you for that update. No, you're welcome.
Could you repeat that?
Yes, so yeah, basically, we are on a temporary pause with our food delivery program for the rest of the month, possibly into December a little bit, but we will have more information by December 8th about the status of the program, but we anticipate being up shortly. And now we are at the question and answer section. If there's any questions in the chat, happy to answer them. If there's anyone who wants to unmute and start a conversation, happy to do that as well.
Let's start some
Chat.
Q&A. So Mauricio had a question. I believe that was back at the Connect for Health section. So it's about what does, quote, some lawfully present immigrants mean? Is it the same categories as the programs had before? And I believe there were some changes. Do we have that specific information?
I will let Anna take that question.
Yes. Same categories.
Same categories. Okay. Next question in the chat. Let's see. If someone receives a diagnosis for cancer, stops working, applies for disability and Medicaid with these changes, would they have to be meeting the work requirements while they wait to be approved or considered as having a disability by either Social Security or the state?
The short answer is yes. The long answer is be very careful about that, about stopping work. I mean, it's not a function of whether or not you are working, it's whether or not you're capable of working. And they don't look at the diagnosis solely as a consideration. They look at your objective medical evidence and functional limitations. So I would be hesitant to advise someone to stop working unless they were really financially well off, because it's not a guarantee that you'll get disability. But unfortunately, yes, you will, until you're proven disabled, the work requirements apply to you.
Question: to qualify for SSDI, do you need to have worked as an adult for the last 10 years or only 10 years in total?
Good question. And I might have not said it very clearly. It actually depends on your age. So certain adults have different work requirements. For most adults, so adults 31 and older, you have to have worked a minimum of 5 out of the last 10 years. Whether that's part-time or not, we can always go into a complicated discussion of what a work quarter is, how much money you need to earn to get a work quarter. But suffice it to say that you generally need 40 work quarters total, of which 20 of them have to be within the last 10 years. You can get up to 4 work quarters a year. So if you do the math, 4 times 5 years is 20, and then 40 total. But it's different for folks who are 30 or under, understandably. I mean, they have not had the opportunity to work as much as older adults. So they have more lenient work history requirements.
Awesome. We got a few more questions. They just keep
Nice.
coming.
No, good, good.
So I can answer a couple of these for you, Eric. Give you a breath. Does application assistance need to be completed in person, or can individuals who are homebound call in to receive assistance? So Benefits in Action does offer service statewide by telephone wherever you are. We'll have a slide in a moment that has our local number, and I'll check and make sure our toll-free number is there as well. But wherever you are in Colorado, if it's inclement weather or you're homebound or just don't want to get out, we can certainly serve you over the phone. And then we do have a few locations. So go to our website at benefitsinaction.org to find our office or a co-location nearest you if you prefer in-person service. But that's where you can find us. Additionally, for individuals who do not speak English, do we provide interpretation? So yes, we do. We have several staff members who speak languages other than English, Spanish, Pashto, Farsi, Urdu. What else do we have? Kurdish, Portuguese. We have several on our team, as well as an interpretation service that provides access to a range of other languages as well. So folks need not bring their own interpreter. We can certainly support them, but if they would like to have a family member or, call and support it first, that's okay. Other questions. Do you offer group assistance if we have multiple individuals requiring similar support? So we do recommend that folks call and make an appointment. Our appointments are individual. If you're seeking a presentation for a group of folks, we do offer those, kind of like this webinar. We have a few recorded on our YouTube channel. And then if you go to our website under the education tab, you could also request a presentation for your group. We'll gather some information about the topics you're looking for, the size and the age of your group, and we can get that scheduled. Okay, let's see, what else we got? Next question. Again, application assistance, can it be done over the phone? It certainly can. I will type the phone number as well to this Q&A so folks can see that as well. And then last question in the Q&A, if a client calls to schedule an appointment for benefit eligibility or SSI application assistance, what is the usual time frame to schedule an appointment? Eric?
That is a good question, and I'm going to be honest, it's not up to par right now. We're pretty backed up. So right now we're booking appointments into January for the services. It's not our goal, it's not what we want to do, but we're training another coworker to speed that process up so that the time will shorten in the near future.
Yes, we are seeing an increased request for that service, and so we're really trying to respond to that need. But thank you for your patience. Certainly give us a call and we'll get you scheduled. All right, any other questions? Feel free to drop those in the Q&A. One moment, let me just answer this one. 435-2. Dropping our numbers in the Q&A. I think everyone can see that since it's not private. I have another question. If someone calls to schedule an appointment for benefit, oh wait, sorry, same question. What is the usual time frame? Right now, we're working to get more individuals trained, and we'll hopefully have them ready to go soon, but we're currently looking into January.
For that benefit specifically.
For SSI and SSI.
Yeah, we don't have as much of a waiting period for some of our other programs.
Awesome. I think that's all the questions in the chat for now. Eric, here we go. Do you assist with Social Security reinstatement?
Oh, like if someone was terminated or if someone's just doing a continuing disability review? Answer to both would be yes, we're happy to do it. We do it on a case-by-case basis just because Social Security's rules are so complex and difficult sometimes. But yes, in a nutshell, we can do that.
One more question. How does BIA get funding to do our work? From a variety of sources. So we are a nonprofit. We're a 501(c)(3). We do receive funding through the State Division of Insurance for our participation as a state health insurance assistance program, helping with Medicare counseling and that free and unbiased assistance. We also receive funding through the Colorado Department of Human Services for our assistance with SNAP outreach and enrollment, helping folks throughout the state recognize, apply, and utilize those food assistance benefits. There are a range of other grants that we work under. We do have a couple fee for service at this time. So most of our assistance is at no cost. However, for SSI and SSDI, Eric mentioned those are on a case-by-case basis. And there is a contingency in place. Eric, do you want to describe that a little bit more for folks?
Yeah, sure. So basically, what that means is that if we are able to prosecute your Social Security case successfully, so whether that's at the initial level or on appeal, because yes, we do Social Security appeals and we're able to represent people in front of administrative law judges if needed. So if the case is successful and there's an award of back pay, a lump sum settlement to the client, we would take a contingency fee of currently it is 25% to of that back pay, but only of that back pay. It would not be anything going forward. And there's, of course, a statutory cap that the law prevents us from charging any more. So what that cap is this year is $9,200. What that means in real terms is that if someone got a lump sum of like $100,000, let's say they've been fighting for years and they got a lot of money, they would not be charged the full 25%. They would be charged $9,200 or 9.2%.
And that's a one-time payment that comes straight to benefits in action through Social Security for those cases that we accept and are successful.
Right. And it's basically to compensate the client. The back pay is to compensate the client for how slow Social Security is in processing claims, and then to compensate us for this work because we are not grant funded for Social Security work.
Awesome. And so we do have one other fee for service that is newer. Eric is also the lead for benefits planning. So that is a service that we will be providing for Medicaid recipients who are on SLS and DD waivers, that's supportive living services and developmental disability. So that will support folks in understanding how work can impact their benefits. Eric, do you want to share a little bit more about that?
Yeah, definitely. Definitely. So benefits planning, as Rachel said, is how work impacts your benefits. And that's not necessarily Social Security, but in often cases it is. But it's any benefit you receive because all the benefits have different income limits, different resource limits. And knowing those and knowing how going to work or accepting a raise at work or stopping work would affect those benefits, things like that. And then for further information, I would point you all to our YouTube channel. We have a detailed benefits planning presentation that goes over a lot of the different work incentives that are meant to incentivize working while receiving benefits.
I'm going to drop the URL to that YouTube channel in the Q&A right now, actually, to answer another question. Yes, you'll receive a copy of the recording. All registrants should. I also just dropped the link to our YouTube channel in the Q&A, so you can find us there. It will also be posted there, along with some other webinars we've recently completed. So thanks for tuning into our YouTube channel. Please do subscribe. We also put out a newsletter about once a month. It's a good way to stay in tune as well. Do we have a list of resources that folks can share with families? One place I like to direct folks for other resources is findhelp.org. I'll also put this in the Q&A. Findhelp.org has a number of nonprofits and community resources and partners like Benefits in Action, and you can search by need type as well as zip code, even outside the state of Colorado. And you can see when the program most recently viewed their listing and made updates, just to ensure that it's not old information. It's also available in a range of languages. So I'll drop that in the chat as well, but that's findhelp.org. All right. Eric, are you a certified work incentive practitioner?
I am. Yes.
Yes. That's a question from one of our folks in the chat. Do
No
you want
worries.
to give a quick overview of that and
Yeah,
what
so
that means?
basically that just means that I've taken the necessary training and passed an exam that allows me to provide these benefit planning services.
Yeah. And not to mention Eric's expertise in Social Security certainly helps him be well primed for the benefits planning program. Right. Awesome. Oh, our attendee Chantel Rockman says she is a Whipsy as well.
Nice. Go, Chantel.
Thanks for joining us. Okay. All right. I think that just about covers it. I'm going to put findhelp.org in the Q&A. You can search by need and zip code. Again, that works great even for folks outside the state if you've got friends or family members looking for help. We do get requests on social media from folks in other states. All right. Thank you guys so much for being here today. Somebody says super helpful. We rock. Thank you guys. We really appreciate you being here today. If Eric, can you fast forward to that screen with
Yes, I
with
can.
our number, website information? Awesome. So please do connect with us. I've dropped the number a couple times. You can direct folks to call us directly if folks need help with benefits. And we encourage everybody, refer us to your friends, family, neighbors, the folks that you serve in your capacity at your role. You can also reach out to our email address, the info@benefitsinaction.org, to ask questions or get service. And then we're on a few social media platforms like Facebook, LinkedIn, and Instagram. And we keep a Benefits Beacon newsletter going out about once a month too. So lots of ways to stay in touch, get involved, and learn about upcoming webinars and other important information. Awesome. Very clear information for very complicated issues. Thank you guys.
Thank you.
Awesome. All right. Well, I think that about wraps it up. Are there any other questions? Let's give it about 60 seconds. See if anybody else has anything else to drop in the chat. Super. All right. Very successful. Thank you guys so much for joining us today, and we hope to do some more of these soon. All right.
Thank you. Have a great day, everyone. It was lovely talking to you.